So in this video, I'm going to discuss about dumping syndrome, one of the most tested Nclex topics, and you will see a lot of question on dumping syndrome because when the Nclex writer, when they are writing the Nclex exam, they always choose the dumping syndrome, and without dumping syndrome, there is no way that they're gonna publish the Nclex test. So you must know about dumping syndrome, right? So I will try to explain you in simple words. Let's begin. So dumping syndrome. Dumping syndrome, what is the definition of dumping syndrome first of all? The definition is, in your Nclex books you will see a definition, when food move too quickly from your stomach into small intestines. When the food move too quickly from the stomach to your small intestines, also known as rapid gastric emptying. So now that is a definition in your book, right? But some of you may not understand what is the definition meaning. So I will try to explain you in simple words. So let's say a normal person versus patient with dumping syndrome. What happened? So once you understand this content, you will be able to get most of your answer right. So let's say a normal person, what happens? So throughout the day, whatever we eat, right? So your food will go, this is stomach, right? Let's say this is stomach. So food will go in your stomach with all the digestive enzyme. Your food will be well mixed. And after that, this is pyloric splinter, right? So what's going to happen once your food is properly digested? Also, the carbohydrate digestion occur from your mouth and mostly happen in your stomach. So everything is mix and match well, right? So what happen after your food is very well digested? This is pyloric splinter, right? This will open and your food will further go to your small intestines, right? So once your food will reach it to small intestines, after that what's happened, the pancreas will sense, they say, food, digested food, and accordingly it will release the insulin. That is happening in the normal person, right? Now let's discuss what happened in the patient with dumping syndrome. So now what happened in that dumping syndrome, due to any reason, for like due to any complication from peptic ulcer or any cancer or any esophageal cancer, where doctor needs to cut the part of your stomach. So let's say this is their stomach, right? So now they need to cut the part, or they need to do gastrectomy, or they need to reconstruct, or they need to bypass. When they're gonna do this kind of thing, your stomach is not gonna be like before. So that's when this pyloric splinter will not be working like before, because this small intestine connected here, right? But now they're gonna cut the part, so they're gonna reconstruct. So this intestine will be added here like this, right? So what's gonna happen after that? The capacity of the stomach is gonna be smaller, and the food, the definition that when I say the food move from stomach to the small intestine quickly, that's mean whatever you're eating throughout the day, it will quickly dump your food here, right, in small intestines. So that's what calls dumping syndrome. See, easy, understandable, right? So whatever you're eating throughout the day, your stomach will dump all your food in your small intestine without even properly mixed with the digestive enzyme. So that's mean undigested food will go in your small intestine from here, like, got it? Because the splinter is not working, because they have to reconstruct or bypass that section. So that is happening in the dumping syndrome. So when this kind of situation happen, what are you gonna see next? So that's what I'm gonna discuss next. So now imagine all your undigested food, and also the capacity of your stomach is gonna be smaller. Before it used to hold more food, but now it's gonna, because they cut the section, they reconstruct, so capacity of the stomach is gonna be smaller size, right? Smaller size. So now what we gonna see next? That's the main question. What we gonna see? So let's say whatever you're eating throughout the day in the dumping syndrome patient, whatever they're eating, their stomach and the small intestine connected like this, right? So whatever they're eating, without even properly mixture of the food, your food is dumping in the small intestine. So that's mean there is no digestion of carbohydrate as well, right? So all your undigested food is going into small intestine, right? So the thing is, what happens next? When the body sense, there is a rule of osmosis. because all this undigested food is known as, is going to work as hypertonic solution. All your undigested food work as hypertonic solution. So there is a rule of osmosis. Whenever they say hypertonic solution, the hypertonic solution pull all the fluids from the blood vessel towards itself. So all your food which is stored in your small intestine, so the rule of osmosis is, because this food is hypertonic solution, right, is working as hypertonic. So this will act as, it will pull all the fluids from your blood vessel to dilute this food, right? So that is happening in this situation. Now when this kind of situation happen, we gonna see the sign and symptoms. What we gonna see the sign and symptoms, that's the main thing for your Nclex. They're gonna ask you about early dumping syndrome sign and symptom versus late dumping sign and symptoms. So now let's discuss first what happened in early dumping syndrome. So early dumping syndrome, which is happen once the patient eat food, it happen after 30 minutes to 60 minutes. So now what sign and symptoms we gonna see? So we're gonna see it's gonna be related to GI, all mostly related to GI. Like let's say nausea, we will see nausea, vomiting, diarrhea, bloating, abdominal pain. We're gonna see this. Why are we gonna see this? Because all your fluid pull from your blood vessel. So when the all the fluid pull from your blood vessel, it will be mostly in your intestine. So that's why you're gonna feel diarrhea, bloated, vomiting, nausea, abdominal cramps. These symptoms you're gonna see 30 minutes to 60 minutes after the meal intake. So that's called early symptoms of dumping syndrome, right? Now if we discuss about the cardiovascular symptoms, what we're gonna see, because all the fluid pull from your blood vessel, right? So now patient will have hypotension, palpitation, patient will be tachycardia because their heart is trying to compensate, so it's gonna be fast heart beating. So we will see tachycardia, palpitation, those kind of thing. So that's what happening in early stage of dumping syndrome. Now let's discuss, let's say if the patient eat the food, right, what's gonna happen after 3 to 4 hours. So we're gonna see after 3 to 4 hours late sign of dumping syndrome. What are the late sign of dumping syndrome and what is happening? So now as I mentioned, all your undigested food is going into your small intestine, right? So now what is happening? So now the pancreas will sense there is a lot of food, because there was no, as I mentioned, there was no digestion of carbohydrate which is occur from your mouth and mostly happen in your stomach, right? But because there was no time for the food to stay in your stomach, so that's why it dump in your small intestine. Now what's going to happen? The pancreas will sense, there are too much amount of undigested food and the carbohydrate is there as well. Now the pancreas will release excessive amount of insulin. So when pancreas release excessive amount of insulin, what we gonna see in the patient? We gonna see hypoglycemic attack. Patient sugar is gonna be drop. We're gonna see palpitation, we're gonna see tremor, we're gonna see confusion, all those kind of things in the late stage of dumping syndrome. Other symptoms we're gonna see dizziness, fatigue, tremors, confusion, and sweating. Those are we're gonna see when the patient sugar level is gonna drop. And these symptoms we will see after the 3 hours when the patient eat. So this is called late symptoms of dumping syndrome. So during your exam, when they ask you about early sign and symptom versus late sign and symptoms, that's what you're gonna choose. So early, all is gonna be related to your GI, like bloating, diarrhea, abdominal pain, cramping, those ones. And early also cardiovascular, you will see palpitation, tachycardia, hypotension, those are important ones. But late stage, after 3 to 4 hours, you will see related question about hypoglycemic attack, which you will see tremor, sweating, confusion, those kind of things. So that's the late stage of dumping syndrome. Next thing, very importantly, the next Nclex they're gonna ask you about teaching to the patient, what we have to teach to the patient when this situation happen. So that's the important thing. They're gonna ask you either early stage of symptom, late stage of symptom, or what teaching you are going to give to the patient. So now let's discuss what teaching you are going to give. So what teaching we are going to give to the patient? what we're gonna tell to the patient to eat? So we're gonna tell to the patient to eat high protein diet, low fiber diet, low carbohydrate diet. Okay, so why high protein diet? Because the food is not staying in their stomach, so their calorie needs to be met. So that's why you need to tell the patient to eat high protein diet. That's the first thing. Next, you are going to tell to the patient to eat low fiber diet. Why low fiber diet? As I mentioned in the previously GI symptom, we see patient is already having too much diarrhea, right? So if you keep giving a high fiber diet, the patient is gonna have excessive amount of diarrhea. Another thing, you have to tell the patient to have low carbohydrate diet. No simple carbohydrate, but they need complex carbohydrate diet, because complex carbohydrate diet don't release the insulin too quickly. So that's why they need complex carbohydrate. As I mentioned, because if you give high carbohydrate diet, as we see the previous symptom, right? Because the food is undigested, because the undigested food is going in your small intestine, and the pancreas is releasing excessive amount of insulin, right? So if you already give too much amount of carbohydrate, is going to disturb more. So that's why they need low carbohydrate complex diet. Now also you have to tell the patient to have 6 small frequent meals in a day. 6 small frequent meal in a day. Don't tell the patient, patient should not eat 3 large meal. When you see this question during an exam, that is a wrong. So you have to tell the patient to eat 6 small frequent meals in a day. And you have to tell the patient to eat food which is room temperature. Why room temperature? It should not be hot, it should not be cold, because if the food is too hot or too cold, it will cause gastric emptying too quickly. So that's why the patient need room temperature food. And another thing, you have to tell patient no fluid intake while you're eating, 30 minutes before and 30 minutes after eating, because it will cause bloating. That's why tell the patient you cannot have drink 30 minutes before and 30 minutes after the meal. When can you have the drink? You can have the drink in between your meals. In between meals, like let's say if I eat breakfast and this is lunch, so now you can have in the middle the water intake, but not with the meal. Okay, during your meal you can have the water. Next thing, you have to tell the patient to eat food slowly and chew thoroughly, because the more they eat slowly and thoroughly is gonna stay in your stomach. Next thing, you have to tell the patient, and this is a very rare condition, so tell the patient once they eat their meal, they have to lie down immediately. They have to this is a rarest condition where you tell the patient after your meal you have to lie down immediately, and that is the most tested question they're gonna ask you. So during a dumping syndrome, once the patient eat their meal, tell the patient to lie down immediately. That's the rarest, but it happen in your dumping syndrome. And also you have to tell the patient to chew slowly and thoroughly, because if they eat slowly and thoroughly, it will stay mostly in your stomach. Next thing, you have to tell the patient to eat food slowly and thoroughly. And also you have to monitor their vitamin B12 level, because the body doesn't produce B12, so that's why they have to take an externally B12. If patient will have lack of B12, it can cause pernicious anemia. So that is very important thing that you need to know, because in dumping syndrome there is a problem in the digestion, right? So that's why you have to monitor their B12 level. So that's the wrap of our dumping syndrome. So watch this video one more time and write down the notes. Hopefully once you see any question regarding dumping syndrome, I hope it's clear and you will get most of your answer right. Good luck.